Higher Health is an organisation that assists with tertiary students' challenges with issues ranging from sexual and gender-based violence to mental wellness. Associated to the Department of Higher Education and Training and the South African Depression and Anxiety Group, or SADAG, Higher Health has come up with a new initiative to assist students and staff at tertiary institutions to cope with mental and psychological stresses that are caused by the coronavirus pandemic. What they've done is they've developed a holistic mental health initiative with a 24-hour helpline. And here to tell us more about this, we are joined by Dr. Ramneek Ahluwalia. He's the Chief Executive Officer of Higher Health. Great to have you, Doctor. Thanks for your time.
Good morning, Leah. Good morning to everyone. Thank you.
You know, in the previous hour, we had an interview talking about some of the mental challenges and psychological strain that employees are facing, at different times of their lives, not going into work, working from home, and the stress of money. But let's shift this to students and also staff and the need for the Higher Health initiative. What are you seeing at a time like this?
Before COVID-19, mental health has been a major pandemic. It's been a pandemic which is globally, and in South Africa, specifically in higher education, this epidemic has always been around. It's hidden, it's stigmatized, but it affects so many human lives on a daily basis. These are young people at the age of 16, 17, 18, joining our TVET colleges, our community education colleges, our universities. We've got a same country where we've got students coming from one of the most disadvantaged backgrounds, from the most rural areas. And with the amount of stress around the academia, a whole future in front of them, a career, the influx of peer-to-peer with alcohol and substance abuse, a massive amount of gender-based violence, which I don't think we should shy away not talking about it. So these are so many stresses, and specifically in a country like ours, specifically affected our youth, that I think mental health probably needs a very severe or a serious attention from everyone around. And I think all COVID-19 has done is it's brought this mental health pandemic much more bigger and quite visible to all of us. And I think it warranted us. Either way, which was being planned from many years to be put in place, it just warranted us to say, well, this comprehensive plan, which was being planned to grow in a phased approach, it's time to do it now. And there's time to go and place it now.
How has the pandemic added stress to both students and the staff at tertiary institutions? I mean, as far as we know that a lot of tertiary institutions, well, they're not having students there, and majority are working online, and some are still at this point in time complaining they don't have devices, they can't learn online, and they may be missing an entire year. So perhaps talk to us about other issues affecting them.
Absolutely. The uncertainty of their own education year to be completed. They have a future in front of them. They have to go and earn for their family. We're an African environment. The one person who comes out of a university or a TVET college, anyone who's skilled, eventually has the highest probability of getting a job. And the reality is, it's something called a black tax, which we all talk about, but that's real. If I am there, I have to look after my extended family, my brother's child, sister's child. So I have to go and earn, and that's the pressure I'm carrying. Similarly, the pressure of completing my education and then moving to the next step is right in my mind all the time. And then an uncertain environment comes around where there's lack of understanding of whether we're going to complete an education career or education this year. How will we do it? Lack of devices, you're right. Lack of data interconnectivity. Can remote learning be practical possible? But on the other side, Leanne, we have opened our TVET colleges. There are certain curriculums and certain courses we cannot do remote. Their practical skills cannot be done remotely. I mean, I as a doctor cannot become a medical doctor if I do not understand the skill of practical learning. So we had to open. So many institutions have opened. Many TVET colleges, CET colleges in the rural skills, but in a phased approach, in a gradual approach, putting systems, putting controls together. Yes, many are still at home in the phased approach, many waiting for the remote learning. The same stresses apply to staff in academia. They're trying their very best to reach out to everyone, and also the fear whether they will have their jobs, whether they will be able to complete the curriculums for them. So it's a very difficult time around everyone in South Africa, beyond post-school education, for parents, for guardians who are paying for these students, bursaries, for academia, for student community, for youth in general. So I think we live in a very uncertain times. And I think if you can provide something 24 hours, now I feel that at most of the time mental health comes at 3 o'clock in the morning or 1 o'clock in the morning. I should not be digging myself into the same hole alone. Can I feel that there's somebody around me? Can I have somebody I can pick up a phone 24 hours free, which is a free phone call, and I can speak to a counselor, psychologist, a psychiatrist, social worker, 24 hours. Maybe we can save lives. Maybe we can help face something which was going to be very adversely affecting us. Could be resolved. Leanne, last point is suicide is the second biggest cause of death in higher education. Second biggest cause of death among youth in South Africa. And I think it's real. It's a major pandemic. So something around you and every time, totally free, can save many lives.
Yeah, you're speaking such truth, and I'm glad that there's a 24-hour helpline. I mean, that when depression hits, it doesn't hit at a designated hour or when the sun is shining. It's when you least expect it. Before we even go on, I want that number. What is the 24-hour helpline number?
So it's 0800 36 36 36. It's quite simple. 0800 36 36 36. 24 hours, this number should be with you. Any student, any staff, anytime. Pick up the phone. We've got 24-hour psychologists, counselors, social workers, under the guidance of psychiatrists. And from there, the first journey starts. The journey starts of helping you, talking through you. You are a rape survivor. You are digging yourself into depression, which is not your fault. It's the stresses around, it's your anxiety around. This is a number that should be around you. Call it anytime. The other second step will follow.
Yeah.
Not only the journey of taking you through at that time, but also then referring you to the right clinical psychologist if further referral is required. The second part of the care, which is the tertiary care. So this is, remember, Leanne, this is the secondary level of care.
Yes.
But then there's the tertiary level, which is linked to mental facilities, it's linked to our own higher health clinical psychologists that are going to be available in all 11 languages.
Okay.
So that counseling can happen.
That is so important. I'm glad you brought that up, that it is available in all languages. I need to ask you this question as well. I know that you are specifically referring to tertiary and higher education. I've many friends that have got kids at this point in time that are sitting in grade 11, they're sitting in matric, and I don't know, my heart for some reason is really with the matrics this year. So much has been taken away from them. This is such a joyous time for them when they, planning holidays and going to be with their friends and matric dances and get-togethers and all these traditions that suddenly have been taken away from them. And I'm seeing massive amounts of depression, particularly within this grouping as well. Are they able to phone in, or is it particularly only for tertiary?
Primarily, my mandate as higher health is all the post-school education institutions, whether it's universities, TVET colleges, community education training colleges. It's open to private higher education institutions. We sometimes forget 20% of our student community is in private higher education, equally facing or vulnerable, or work-based learning centers or CETAs. We haven't. It's not my mandate. But I'll be very happy because at the end, that future comes to us. A grade 8 eventually comes to our TVET colleges. A grade 12 eventually comes to us in our universities. So grade 4 and CET colleges. So we've got phased approach of school system dropouts coming into our colleges or school pass outs coming into us. So I will definitely, as my commitment, reach out to Department of Basic Education, to my fellow colleagues there, and I'm very close to them. We meet them very often. I would like to extend this. At this point, it's been very much to the post-school education, but I would be very happy And as you, Leanne, rightfully said, it can be a number for everyone. It will require capacity. It will require more depth, thinking around younger adolescents, which are less than 15, 13, and a different kind of a strategy for them. But yes, it has to be thought about and it has to be considered. It has to be considered very quickly.
Yeah. I thank you so much for your time. This is such an important issue. And as you have heard, this is a 24-hour helpline. It's open 7 days a week. There is somebody there to speak to you. And that number again, it's on your screen. Write it down, please. 0800 363636. It's simple, but it can save your life. And that is what we're trying to do here, because it is a very, very tough time. Thank you again, Dr. Ramneek Ahluwalia, who is the CEO of Higher Health, talking to us about the initiative to support both students and staff at tertiary institutions with mental health issues amid the coronavirus pandemic. Let's take a break. We'll be reading some of your tweets after this as we close off for the week. Stay tuned.
Sunlight, it's freshness that stays with you.
Not all washing powders are the same. Sunlight adds fabric softness to washing powder to give you Sunlight 2-in-1 for sensational cleaning and fragrance that lasts and lasts and lasts. Sunlight 2-in-1, sensational cleaning and long-lasting fragrance.
Mom's got a headache. Get Calpol. That one, the pink one.
There's a blue one for Mom now.
New Calpol tablets for pain and fever, now for adults. Calpol tablets release medicine 5 times faster and provide effective relief from pain, fever and headache so that you can get back to life fast. New Calpol tablets for pain and fever, 5 times faster, now for adults.
London will be split in two, but only one side will leave as champions. History will be made right here at